Madam President, as we consider the CARA bill on the floor at this time, as we consider the bill to deal with this opioid epidemic in our country, I thought that it might be useful if I just bring a few statistics out here so that we can consider the nature of the epidemic which we are dealing with. In 2014, 29,267 people died from prescription opioid and heroin overdoses in our country. 10,574 of those people died from heroin. That's a 28% increase from 2013. Can I say that again? There was a 28% increase in heroin deaths in our country in 1 year. That's the trend line that we're talking about with this epidemic. Deaths from synthetic opioids, like fentanyl, increased 79% from 2013 to 2014. Can I say that again? A synthetic opioid, fentanyl, had an increase of 79% in deaths from 2013 to 2014. Here's another statistic. Today's young white adults, aged 25 to 34, are experiencing the highest death rates since the Vietnam War. Can I say that again? White adults between the ages of 25 and 34 are experiencing the highest death rates since the Vietnam War. In 2014, an estimated 1.9 million people had an opioid use disorder related to prescription pain relievers, and an estimated 586,000 had an opioid use disorder related to heroin use. This is the profile of the epidemic that we have in our country right now. In the 5-year period between 2008 and 2013, overdose deaths from prescription painkillers and heroin combined increased 37%. In 2010, enough opioid painkillers were sold to medicate every American adult with a typical dose of hydrocodone every 4 hours for 1 month. In 2012, healthcare providers wrote 259 million prescriptions for opioid painkillers, enough for every American adult to have a bottle of opioid painkillers in 2012 in our country. Can I say that again? Enough of this opioid painkillers were prescribed so that every adult would have a bottle on their shelf in 2012. Pick a number. How many 10-milligram opioid painkillers were approved by the Drug Enforcement Agency in the year 2014? Just pick a number in your brain. How many pills were authorized to be manufactured in our country in 2014? Just pick a number in your brain, 10-milligram pills of opioids. Here's the answer. You were wrong. The number is 14 billion 10-milligram pills equivalent were authorized to be manufactured in our country by the federal government, by the Drug Enforcement Agency in the year 2014. Again, all of this is part of the recipe. Stir well, ignore it for about 15 years, and let our country finally recognize that there's an epidemic in their house, on their street, with their relative, with their friend, that should never have happened, because we know what the cause of this issue is. This unparalleled rise in overdose deaths in the United States parallels a 4-fold increase from 1999 to 2010 in the sale of opioid painkillers. We know that there has been a tripling in the number of overdose deaths from 1999 to 2012 in our country. But we also know this, that America is only 5% of the world's population, and we now consume 80% of all of the opioid painkillers in the planet. Again, this is not some big puzzle in terms of what has caused this problem. This is all very simple, easy to understand stuff that ordinary families have been grappling with, especially over the last 10 years, beginning with their understanding that OxyContin and Percocet and all these other drugs that are allegedly, quote unquote, abuse deterrents are in fact, when they're swallowed pursuant to a prescription, if done on an extended basis, can cause the addiction that's even worse than whatever the problem is that's underlying that in the individual that they're taking these painkillers for. Roughly 480,000 emergency room visits in 2011 were attributable to the misuse and abuse of opioid painkillers in our country. 488,000 emergency room visits for that one issue. The prescription painkiller epidemic is killing more women than ever before, and it is estimated that about 18 women die every day from a prescription painkiller overdose. The numbers are staggering. We should create a requirement that if the DEA is going to license physicians to prescribe opioids, and every physician in America must go to the DEA to get a license, that if they're going to be allowed to prescribe, the physician proves that they've been educated to do so. Right now, according to the FDA, which 2 years ago authorized a voluntary education program for physicians, pick a number in your mind. What percent of all physicians in America have taken advantage of a voluntary education program for opioids? You're wrong. Whatever number you just picked, it's only 12% of all physicians have actually taken the voluntary education program. The FDA continues to authorize new opioids on the market without even having an expert advisory panel to be able to deal with the issue, even as the DEA continues to authorize 14 billion 10-milligram pills per year. So this issue is one that we have to deal with. We should have physician education. We should have tighter standards for what the FDA does in allowing for new drugs to go out on the market. And we have to ensure that they're safe, and we have to ensure that there's a proper understanding of their abuse potential. And we have to have a day of reckoning with the costs of all of this. We have to make sure that the funding level is there for families who are already suffering. We have to provide the help for them. We just have to. This is an epidemic that largely was created at the federal level, largely created by physicians, pharmaceutical companies. And it's time for us to finally begin to provide the help these families so desperately need. But here's what we know. Here's what I know most. It won't even be those who right now have the problem, although those families will get the help that they need. It's all the families who will never need the help because we did put the right recipe on the books. We did put the right prevention measures on the books. We did put the preventative measures on the books so that their families never even knew this day arriving in their history. I just hope that as we go through this whole process that we can keep those thoughts in mind. That's what we can do from the federal government. We should strive to do this. We should try our best to just stand up and provide the help that these families need at the local level. And Madam President,